Over the last 4 years, Kampala has registered unhealthy levels of ambient air pollution with figures 5 times above World Health Organization requirements. This situation only slightly improved during the COVID-19 induced lockdown. According to the statistics from the Eastern Africa GeoHealth Hub for Research and Training, in 2018, there was average pollution of 39 micrograms per cubic meter, 34.9 in 2019, 37.4 in 2020, and 42 micrograms per cubic meter in 2021. The pollution is blamed on, among other things, vehicle exhaust and non-exhaust emissions, dust from unpaved roads, and open burning of solid waste, among others. An assessment by Makerere University School of Public Health conducted last year in Kampala reveals a bigger problem with indoor pollution. Results from the assessment of a household air pollution exposure in Kampala indicate that child personal exposure within household environment was at an average of 78.7 micrograms per cubic meter, 5 times higher than the World Health Organization recommended range of 15 micrograms per cubic meter. Kawempe Division had the highest average of 95 micrograms per cubic meter, followed by Nakawa with 80 micrograms per cubic meter, Makinde coming in third position with 67 micrograms per cubic meter. Rubaga and the Central Division tied at 59 micrograms per cubic meter.
Air pollution was about 17% of the death, and this is similar to the previous year, 19%, meaning that we are having many deaths that could be attributed to exposure to PM2.5. When we take the WHO annual mean of 5 micrograms per cubic meter.
This pollution has also started taking a toll on the health of many people, with increased cases of respiratory illnesses reported.
We have very many children with asthma, and a lot of it can actually be attributed to the air pollution, either from within their homes, on their way to school, or even within the schools.
The Director of Public Health and Environment at KCCA, Dr. Daniel Okello, confirms the dire state of affairs.
It is not enough to actually say 7 million people are dying annually, but for COVID, 6.8 in 2 years. So the measurement now has to change, and to say who are those 7 million people. So now the measurement has to be something that people can feel.
The data we have gathered, including the information you are giving us from the US Embassy and the Makerere University, 5 times worse than what is recommended by World Health Organization. And that is quite alarming. It's worrying.
In Lagos, Nigeria, air pollution has not only affected the city in terms of loss of lives, but also economically.
We're looking at about $2.1 billion estimated loss annually from 2018. In terms of human capital loss, we're looking at about 33,000 annual deaths.
The experts, however, note that the biggest challenge is lack of awareness about the effects of air pollution.
What most people don't appreciate is that the air you breathe, even though you're not seeing the smoke or you're not seeing the dust, as long as you're breathing, you're taking the toxic substances.
They shared tips on what needs to be done to address this problem.
Air quality, air pollution has been taken as an environmental issue mostly. So it has been a little bit in the backwater. Now bring it to the front and saying there's actually a human component to it that affects humans. I think that's what we need to emphasize more.
You need to work with them, the participatory approach in designing those messages.
We are working on the clean air plan for African cities that's going to guide our engagement going forward as cities, researchers, and other stakeholders.
But also community sensitization would be a good thing to make sure that people know that they are exposed. They may not get the disease immediately, but over time it will catch up with us.
Benjamin Jumbe, NTV.